So a couple of things. Number one, it's good, we're talking about this IPAB issue, the independent board, because in the president's plan, which was not just not a speech or press release, but a plan, we put out levels of detail that included saying that in 2018 and beyond, we actually would tighten our focus on Medicare growth by saying that where it was above GDP plus 0.05 per person in Medicare, that the IPAB would look for additional savings. So first of all, we're having this discussion now about our plan because we have put out significant details. Look, here's the justification for it. A lot of people for years, Democrats and Republicans, said Medicare, unlike Social Security, is a little harder just to figure out what, combination of different adjustments or revenue adjustments you need, because healthcare is very dynamic. But unfortunately, we don't act as much because it has often been caught up in the political system. So the idea was to try to create a more independent, non-political way of dealing with that. And there's been a lot of accusations of demagoguery, but if someone doesn't like that idea, let's have another suggestion. But the basic idea of bringing more expertise into our system, more independent expertise to help adjust Medicare as we learn more about quality and delivery system efficiencies in a way that doesn't have to go through two houses of Congress all the time, doesn't have to be subject to all the politics, was I think a very well-intentioned and I think smart idea. And if it's not the best idea, then let's hear something. I think one of the most unfortunate things going on right now has been the complete politicization of the Affordable Care Act. President Obama does not sit around and say, boy, we're going to defend every little thing that we've done to the T. He would welcome constructive criticism or comments about how we could do things better. But we have a health care spending problem in our country, and we put together a very thoughtful effort that tried to take all of the type of reforms, whether affordable, the comprehensive care, the different payment systems, the IPAB, and these things right now have just become political fodder. So part of the reason we're not having, so I agree with Chairman Ryan on one thing. We should be able to have more serious discussion about the specifics of our plan, and I think it would make it easier for us to figure out what we agree and disagree on and how we could make progress.